Ooh, let's talk about some cases. Grace. So Grace is really a loyal patient. She came to me with one wish. She wanted to get her off her Advaire for 20 years. So this was when I was just doing OMT. It took me 2 years and 40 OMT visits, I count. And then I look at the costs. And, but afterwards, she thinks that was worth it. She's done with her Advaire. Her mechanism of trauma, when she was 3 months old, this was back in the day when infant car seats, they were allowed to put them in the front. She slipped out through the restraint and she torpedoed her head into the dashboard. So she's kind of, you know, that long axis compression. So this is secondary. You know, birth is the first long axis compression. Normal vaginal birth is the first long axis compression. So then we did the treatment. She's good. She's happy. She's gone. She disappears. And then she comes back out of nowhere and she's been in 3 MVAs. Boom, 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 right out. And then so her asthma acts up. So I added prolotherapy. I did everything. The hips, the C-section scar, the thoracics. And she was done. She was responsive with the prolotherapy, but that, gosh darn it, that chest tightness kept coming back, that old asthma thing. So I finally, she wasn't having any pain, it was just the tightness. And I finally convinced her, and she trusts me because our interests are aligned, because it's driving me nuts, that she's not getting better, and she knows I want her to get better. Stop coming back. So I told her, come on, let's do PRP to your thoracics to help your asthma. And she trusted me, and I sent her to my partner, and my partner injected her, and she said, the day your partner injected me, Dr. Huang, the chest tightness went away. Done. And so now she's free, completely free in the chest. So that means that for the osteopathic that we're doing, unloading the car accidents and the PRP to the thoracics have freed it up enough that she's good and done. And it unloads pretty much the truncal portion, the chest portion of this long axis compression. And then we ended up trying to free her up of her allergies and her chronic congestion. And that's Grace. And let's go. So what are we doing? We proload her TMJs, her neck and her head, and guess what? She's not moving. And thank you, Gerald. I have to give you props, and thank you for the chronic fungal sinusitis talk from last year. You need to do that again. I started her on, anybody who's on Advaire, you might want to consider that. I started on diflucan, but guess what? Oh my gosh, she developed a rash. So I called the pharmacist, and the pharmacist says, I've been doing pharmacy for 20 years. I've never had a patient have a rash. What are we going to do? What can I do? There's nothing left. So we stopped it. And then she came in. She says, I just couldn't take it. My allergies acted up. Not the asthma. The allergies acted up. And you know what? I felt her skull, and it's an ossified mess, osseous lesion mess. You take a look, it's a little smaller than the rest of her face. The bones are hard, they don't move. There's a chronic inflammatory state that tightens everything. So all my magic and all my osteopathic skills are not gonna budge this as long as she's inflamed. How do I know? Because we did immunocap specific IgE to test her, and she was 6 out of 6 on Aspergillus. So she was positive with everything else, but I think the chronic inflammatory state from the chronic fungal exposure made everything else bad. And so now we're trying to figure out how to not have her react to diflucan. So I'm using a homeopathic fungal nosode specifically for Aspergillus, and I sent her home. But my theory on the chronic inflammatory state causing tightness and osseous lesions to be magnified, she came in really bad. She took some steroids. And that mechanism, this whole thing was soft, way softer. And it was, wow, that's what steroid does? Yep, it does.